There are entire business models built around selling access to physician supervision. People pay tens of thousands of dollars per year to do that.
And that ends up costing you more when you need care. When North Carolina expanded Medicaid, the people behind it said it meant 600,000 people who didn't have health insurance were now going to get it. But the law did nothing to increase the number of people providing that health care.
There has been a battle in the General Assembly since 2013 to revise rules that cover how nurses with the highest training can go about their jobs. And as you'll see in tonight's Buckley Report, some people say it is a simple fix for that problem.
Hello, how are you today?
Shaquithia Peacock has been a nurse for more than a quarter century and been part of a legislative fight for even longer.
It seems like you've been fighting this battle for decades.
Absolutely.
Peacock is the chairwoman of the North Carolina Nurses Association Council of Nurse Practitioners and is working to get this legislation passed, the SAVE Act, which would be the first major update to nursing protocol since the 1980s.
And those rules don't make sense anymore.
Chris Kauthperwaite is with the State Nurses Association.
28 other states have passed bills similar to the one that we're trying to pass. None of them have said that that was a mistake and tried to go back.
As North Carolina law stands now, a physician has to oversee the work of nurse practitioners, midwives, and anesthetists, even though those professionals are only doing work that they're trained and certified to do.
And the evidence is squarely on our side of this issue. Decades of research have shown that the care that advanced practice registered nurses provide is safe, effective, that they are excellent at what they do within their scope, what they're taught to do.
Physicians like Marianne Contagianis aren't so sure.
I serve on the North Carolina Medical Society's Medical Task Force Committee.
She's a plastic surgeon who discussed the need for oversight when she ran for Congress recently.
We've looked at the training that's involved. And when you look at the training, there's just no comparison with either a PA or nurse practitioner in the training that we get.
The doctors' groups appear to be saying that this is a bunch of nurses trying to play doctor. Is that accurate?
I'd say no, because I don't want to be a physician.
What Peacock and others would like to do is help fill the gap in smaller towns where physicians often won't go and do the large body of work that she is trained for. But getting what some nurses refer to as a permission slip from a physician can cost as much as $30,000 a year.
Expense, yeah. Expense can really take a practitioner out.
The SAVE Act won't change what she does or how. Her training allows her to diagnose patients, order tests, and write prescriptions.
But they have that now. All they've got to do is just report to the physician.
What will change is how I complete the paperwork associated with that statute requirement, which says that I should have a physician and meet with one on an every 6-month basis, now that I've been practicing for 26 years.
The physicians' advocates don't seem swayed by the argument.
The medical lobby has not negotiated with us on this at all. They will not come to the table to even discuss if we can move it forward incrementally or not.
Do you think you have the backing to make this happen?
Absolutely. If we could get our bill to the floor, we are very confident that it would pass.
Although the bill to reform this oversight has had trouble in both chambers of the General Assembly, the greatest opposition appears to be in the State House. Bob Buckley, Fox 8 News.
The Nurses Association emphasizes that what state law calls supervision isn't what most people in the public think it is. It's not a doctor sitting in on every case. In many instances, they may meet with the nurses for as little as 15 minutes every 6 months.